The confrontation visual field examination is considered one of the vital signs of the eye. Consultants will expect this to be performed when you ask for their help. By the end of this activity, you will be able to demonstrate the ability to obtain and document an accurate confrontation visual field examination on a patient with an eye complaint. You will also be able to explain the 5 important confrontation visual field examination abnormalities and the conditions these findings suggest. This includes a monocular visual field deficit of any type, a bitemporal hemianopsia, homonymous hemianopsia, central scotoma, and an altitudinal defect. Why should we perform a confrontation visual field examination? The confrontation visual field examination is considered an ocular vital sign and is a screening test for visual field defects. Consultants will expect this examination when you seek their help. Confrontational visual fields tests peripheral vision and is much less precise than visual acuity, which is the test for central vision. Confrontation visual field testing may detect a dense field defect, such as a right homonymous hemianopsia seen here. Confrontation visual field testing is a low-technology, low-sensitivity test that is performed when formal testing, such as the Humphrey Visual Field Test, is unavailable to be performed. When performing a confrontation visual field examination, the ability to count fingers in these 4 quadrants in each eye is the measured variable. The first step of the confrontation visual field testing is for the patient to put on corrective lenses if they have them. Then face the patient with all eyes at the same level at arm's length. Each person covers their own untested eye. Have the patient look directly at the examiner's eye opposite theirs as a point of fixation. Check the patient's right eye first. The ability to count fingers is the measured modality. Use 1, 2, or 5 fingers, as it is difficult to discern between 3 or 4 fingers. Start in the superior temporal quadrant and ask the patient, "How many fingers do you see?" Then go to the inferior temporal quadrant. Then go to the superior nasal quadrant. Then go to the inferior nasal quadrant. Then repeat these steps, testing the left eye. What if they miss or incorrectly identify a quadrant? Finish your examination and return to that quadrant and try again using a different finger combination. What if the patient misses a quadrant on the repeat attempt? Use hand motion, starting from the peripheral vision to the central vision. Documenting confrontation visual fields, or CVF, can be documented as CVF full OU, where OU means both eyes. A more detailed documentation method might be CVF full to finger count in all 4 quadrants, OU reliable. If hand motion was utilized, then CVF full to HM in all quadrants, OU, would be concise documentation. The list of the 5 most important confrontation visual field abnormalities starts with a monocular visual field deficit of any size. The mnemonic go-kart MTV represents the differential diagnosis of monocular vision loss and includes acute angle closure glaucoma, optic neuritis, central retinal artery or central retinal vein occlusion, amaurosis fugax, retinal detachment, temporal arteritis, migraine, trauma, vitreous hemorrhage. Bitemporal hemianopsia, or the loss of temporal or the outer fields in both eyes, is classic for optic chiasm compression, specifically from a pituitary mass. Homonymous hemianopsia is loss of the same side of the visual field in both eyes. For example, left half is gone in each eye. This suggests a postchiasmal lesion, such as the optic tract, radiations, or occipital cortex. A central scotoma is a missing or blurred spot in the center of the vision, where the patient cannot see the central target. This suggests macular disease or optic neuritis. A superior altitudinal scotoma means loss of the upper half of the visual field, often respecting the horizontal meridian. That pattern most often localizes to a vascular supply deficit to the retina or optic nerve head, but can be mimicked by other processes. This is an important diagram to understand, as board exam question writers love to use this as fodder for questions.